Hello there, Lebur Rohman here, Consultant Sports Knee and Joint Replacement Surgeon. In this video, I'd like to talk to you about partial knee replacements, what they are, how patients present, how we diagnose them, and how we go about doing the surgery and the results of the surgery. So partial knee replacements essentially are replacing or resurfacing part of the knee, only the diseased segment of the knee, as opposed to replacing the whole of the knee, which is a total knee replacement. So patients often present with pain, stiffness, swelling, often only localized to one area of the knee. Usually this tends to be the inner aspect of the knee, but can still happen on the outer aspect and to the front of the knee behind the kneecap. As a surgeon, we'll go about trying to diagnose this with a thorough clinical history and examination. And following the examination, X-rays are paramount in diagnosing this condition. Some surgeons will elect to do a MRI scan also to look and make sure that the other segments of the knee are healthy. But often, I'd probably say 9 times out of 10, X-rays are sufficient to diagnose this condition. Once the condition is diagnosed and a partial knee replacement is offered to the patient, the partial knee replacement is often a day case procedure. The patient goes home the same day, a minimally invasive surgery is carried out, and resurfacing of the diseased segment is carried out. The patient is walking the same day and often loses their crutches at about 2 weeks. And in my practice, 99% of my patients are discharged at 6 weeks and they're back to all of their full activities. So when we compare that to a total knee replacements often can need an overnight stay, but can be done as a day case in some cases. They require a lot longer recovery period. Most of my total knee replacements are discharged at about the 3 to 4 month mark fully, and they have significantly more risks because the operation is much longer and more invasive, and the functional outcomes of a partial knee, because only part of the knee is replaced, it leads to a much more naturally feeling knee than compared to a total knee replacement. And the evidence demonstrates that the functional outcomes are 2 to 3 times better for a partial knee than a total knee replacement, with 50% less reduction in risks and complications. And in terms of longevity, patients often have a misconception that a total knee will need to be done eventually anyway, which is incorrect, because in high volume surgeons like myself, the partial knee replacement 10-year survival is about 97 to 98% survival, which is comparable to total knee replacements. So most partial knee replacements are easily lasting 15 to 20 years, which is very similar to total knee replacements. So if you'd like to find out more about partial knee replacements, please get in touch and I'll be happy to have an assessment and go through the pros and cons with you. Thank you.